Chapter 21, Therapeutic Agents for the Respiratory System. We have select common drugs for the conditions of the respiratory system, which we will go over more in depth throughout the chapter. But these are nice because they have the pronunciation and the generic and brand name. So these are common, so I would learn to say these, so it's great that they have the pronunciation there. So the lungs and airways play an important role in the body. The respiratory system has many elements with various functions. For example, they facilitate oxygen absorption during inhalation and carbon dioxide removal during exhalation. The fine nose hairs and bronchial mucosal lining filter and trap dust, microorganisms, and foreign particles. Mucus engulfs these unwanted particles, then cilia propel the mucus for the throat to swallow. The nose also helps to heat and humidify cold, dry air to our body temperature. And here's a diagram of the respiratory system. So we have the diaphragm, we have the bronchioles, those are the little tree-looking things. We have the bronchi, here and here, the trachea, the larynx, the pharynx, and the nasal cavity. The lungs resemble a large inverted multi-branched tree. The large trunk is the trachea, and the two main branches represent bronchi. The smaller branches are bronchioles, and the leaves are the alveolar sacs for gas exchange. Just a little more closer picture. Here's the alveolar sacs. The nose, nasal cavities, the pharynx, the throat, and the larynx, the voice box, make up the upper respiratory tract. The larynx or voice box contains the vocal cords for speech. The trachea, bronchial tree, and lungs form the lower respiratory system. Mucous membranes line the trachea and trap airborne particles. The cilia propel the particles upward for swallowing. The trachea branches into the right bronchus and left bronchus, leading to the right and left lungs, respectively. Rings of cartilage reinforce the trachea so that it does not collapse when the neck bends. Two bronchi branch from the trachea. They split in turn into smaller bronchi and bronchioles. Bronchioles deliver air through the lungs and into alveoli. Respiration occurs in the alveoli as oxygen and carbon dioxide pass through the tiny capillaries surrounding them. The lungs fill the chest cavity except for the space occupied by the heart and large vessels. Their purpose is ventilation and gas exchange. The lungs have many lobes, 3 in the right lung and 2 in the left. The left lung has a surface dent, the cardiac notch, to accommodate the apex of the heart. At the base of the chest cavity is a major respiratory muscle called the diaphragm, which enables inspiration and expiration. This large dome-shaped muscle separates the chest cavity from the abdominal cavity. It contracts and flattens during inspiration and it relaxes during exhalations. Other muscles support breathing. So you can see the right lung has 3 lobes, whereas the left only has 2. We divide respiration into 2 distinct phases: inspiration as air moves into the lung and expiration as it moves air out of the lungs. The respiratory control center is the medulla in the brainstem. It automatically controls the rate and depth of breathing depending on the body's oxygen needs. And here is a figure of mechanisms of ventilation. Breathing rates vary depending on the size of the person. For example, small children can breathe twice as fast as adults. The normal amount of air expelled from the lungs in a typical exhalation is approximately 500 ml or 0.5 liters for an average adult. So that's kind of huge if you think about it. The total lung capacity is more than 5 liters of air. The lungs' elasticity allows capacity allows the capacity to vary widely depending on oxygen need. So here's some medical terms used in describing various types of breathing dysfunction. We have apnea, bradypnea, cyanosis, hyperventilation, orthopnea. Some medications can alter respiratory rates. For example, opioids can suppress the respiratory rate. Room air contains approximately 21% oxygen, 79% nitrogen, and less than 0.5% carbon dioxide. As we breathe, the lungs exchange inspired oxygen for expired carbon dioxide, which is waste. From the alveolus, oxygen molecules move across thin membranes into passing red blood cells in nearby vessels. Red blood cells drop off carbon dioxide molecules and recover oxygen molecules. Carbon dioxide molecules move from the lung capillary blood supply into the alveolar sacs and out via expired air. The heart pumps oxygenated red blood cells to tissues and organs. So here's an exchange of oxygen and carbon dioxide. The exchange of oxygen and carbon dioxide also keeps the blood pH balance. The body uses some carbon dioxide to make bicarbonate, which maintains the blood pH level close to 7.4. Conditions that affect the respiratory system are genetic, contagious infections. They can come from habits like smoking and environmental factors. Respiratory illness symptoms manifest as abnormal breathing and coughing, although upper respiratory illnesses are diverse. Similar types of medications treat most of the conditions. These drugs include antitussives, analgesics, antipyretics, among others. So here are some common infections of the upper respiratory system. We have allergic rhinitis, the common symptoms of stuffy nose and congestion, and we usually give antihistamines and nasal corticosteroids. For influenza, fever, chills, headache, muscle aches, fatigue, and cough, analgesics and antipyretics are used to treat those. The common cold is a self-limiting illness that encompasses a group of disease caused by various viruses. The common cold is the most frequent acute illness in the United States and other industrialized countries. Common symptoms of the upper respiratory infection include nasal congestion, runny nose, sneezing, sore throat, cough, fever, headache, and fatigue. Good hygiene and hand washing and using hand sanitizer and proper sneezing techniques help limit viral spread. So remember, you should always be sneezing in your elbow, especially if when you're working. Antihistamines alleviate rhinorrhea and sneezing. Their use, especially of first-generation products, causes sedating and mucous membrane drying effects. So this is just normal Benadryl over the counter. Antitussives suppress a cough. Patients with the common cold may have a dry, unproductive cough, and antitussives give symptomatic relief. Here's just a picture. So it's Robitussin, can be Delsum, it can be the store brand like Walgreens. This is Walgreens Welltussin. Every store probably has their own. Also, phenergan with codeine can be prescribed for a cough. Less likely though because it is a controlled substance. Expectorants like guaifenesin break up thick mucus lung and bronchial secretions for easy removal through coughing. Pharmacists should counsel patients to increase fluid intake, which helps thin mucus. And Mucinex is also a guaifenesin, and there is Robitussin is guaifenesin as well. I don't think it says that. So Robitussin is guaifenesin with dextromethamphetamine. Doesn't say that, but then over the counter we have Mucinex, which is guaifenesin. And pharmacists usually recommend patients to take the liquid. I've heard from them that it works better at breaking up the mucus, and the Mucinex is really expensive compared to that. Decongestants affect the adrenergic receptors of the vascular smooth muscle, leading to constriction of blood vessels and a decrease in mucus production. Many decongestants are available as OTC products. Hypertensive patients should avoid these. So these are the Sudafed that is kept behind the counter. If a patient does have hypertension, the pharmacist will recommend that they do not take this because it can increase it. There is Sudafed that is still on the shelf, different from pseudoephedrine. It is phenylephrine, and you can buy that over the counter. From pharmacists, I've heard it doesn't work as good as pseudoephedrine, but I think it's okay for people with high blood pressure. Cromolyn sodium is a synthetic compound manufacturers hoped was an improved bronchodilator, although it lacked bronchodilating properties. It inhibits antigen-inducing bronchospasms. Cromolyn therefore works as a prophylactic agent for asthma in a nasal preparation for seasonal allergic rhinitis and nasal congestion. Some evidence suggests that it can help improve symptoms of the common cold. An allergy is an abnormal response of the immune system to an unrecognized typical harmless substance. Types of allergens vary widely and include pollens, animal dander, food, medications, chemicals, or environmental pollutants. They are one of the most common types of respiratory problems experienced by approximately 50 million U.S. residents. Symptoms are rash, hives, itching, and nasal congestion. Severe reactions can be stomach pain, vomiting, sneezing, shortness of breath, hypotension, and swelling of the throat. And we have select prescription medications for the treatment of allergies. So we have quite a few. Most of these are over the counter now. Pretty sure Rhinocort is, Flonase is, Nasacort is. Antihistamines over the counter, most of these. Allegra, Xyzal. And we have our leukotriene receptor agonist, singular. Rhinitis is an irritation and inflammation of the mucous membranes lining the nasal passage. Post-nasal drip comes from mucus accumulating in the back of the nose and throat. Drinking fluid thins the post-nasal drip mucus and helps with expectoration. And here's just kind of going over the nasal spray. So it has a common adult dosage, which is kind of nice. A severe viral respiratory illness is the flu or influenza. Influenza infects the respiratory system, including the nose, throat, bronchial tubes, and lungs. Influenza causes millions of dollars of lost wages and healthcare costs each year. In the young, elderly, and immunocompromised, it can be deadly. We do have treatment for the influenza and prophylaxis. So we have amantadine, which is used for the influenza A virus, but it can be used for influenza prophylaxis. And same with Flumidine. Tamiflu can work on A or B influenza and can be a prophylaxis for someone who's immunocompromised. And the Relenza Discaler is available for influenza A or B infections and for influenza prophylaxis. Asthma is a chronic inflammatory condition that affects the airways. It is one of several obstructive lung diseases that share some clinical characteristics of COPD. The classic asthma signs include intermittent dyspnea, which is shortness of breath, cough, and wheezing. In asthma, the muscles around the bronchioles contract, narrowing the air passages. Because asthma is an inflammatory disease, certain triggers can cause inflammation of the airways, leading to the mucus production and bronchial constriction previously mentioned. The most common triggers of asthma attacks are exposure to allergens, such as animals or the environment, irritants, as well as exercise and stress. So figure 21.8 has the interrelationship between the disease entities making up COPD. So you can see they're kind of all linked together. But the chronic bronchitis is more on the emphysema side than the asthma side. Figure 21.9 just depicts asthma obstruction. And then we have select agents used in the treatment of asthma and or COPD. So we have inhaled steroids. They exert anti-inflammatory actions to reduce inflammation in the airways. So we have Q-bar inhaler, Pulmicort flex inhaler. We also have Pulmicort rest pulses, which are for the nebulizer. We have Flovent discus inhaler, and then we also have a Flovent HFA. We have short-acting beta agonists, which activate beta-2 receptors in the lung, leading to relaxation of the bronchial smooth muscle, in turn leading to bronchodilation and an increase in bronchial airflow. So we have 4 different inhalers now that are albuterol beta-2 selective. They're all considered the same medication. They just have different brand names. So we have ProAir HFA, Ventolin HFA, and Proventil HFA. And then we have Vospire ER, which must be new because I didn't know of this medication when I worked in pharmacy last. So it is new to the market. For long-acting beta agonists, they activate beta-2 receptors in the lung, leading to relaxation of the bronchial smooth muscle, in turn leading to bronchodilation and an increase in bronchial airflow. So we have Brovana, Performist, and Servant Discus. So these medications should be used all the time, no matter how they're feeling. Whereas the short-acting beta agonist, you kind of take when you're feeling asthmatic or like you might have an asthma attack or feeling out of breath. Those are kind of just taking acutely, like when needed. But the long-acting beta agonist should be taken every day, no matter what, to prevent asthma and COPD. We have inhaled anticholinergics. They block the effects of acetylcholine, leading to bronchial smooth muscle relaxation. We have Atrovent HFA and Spiriva. Spiriva is a little capsule that gets put into an inhaler and inhaled. We have methylxanthines like theophylline. They relax the smooth muscle of the bronchial airways and pulmonary blood vessels. We have leukotriene receptor antagonists. They inhibit the effects of leukotrienes to reduce bronchial smooth muscle contraction, airway edema, and mucus formation. So we have Singulair, Montelukast, and Accolate. We have a phosphodiesterase 4 inhibitors that inhibit the enzyme PDE4, an effect that is thought to reduce inflammation. So we have Daliresp. We have anti-IgE antibodies, which block the inflammatory effects of IgE. So we have Xolair for asthma. We have a mast cell stabilizer, cromolyn sodium. It inhibits degranulation of mast cells of the immune system, preventing the release of histamine and inhibiting inflammation. We have a mucolytic agent, acetylcysteine, most commonly called Mucomist, but it has acetido and cetylev. I don't know those two, but Mucomist definitely have seen that prescribed quite a bit in both hospital and retail pharmacy. Reduces the viscosity of mucus secreted in the lungs and aids in the removal of these secretions through coughing and or drainage. Then we have combination products because we realize 2 medications are good. Let's figure out a way to combine them. So we have Combivent, Respimat, Duoneb. So that's for the nebulizer. We have Symbicort, Dulera, and Adverse Discus, and Advair HFA. So all of those are, besides maybe the top 2, I'm not 100%, but the last 3 are all medications that should be taken every day, no matter how the patient feels. So A is the proper use for an inhaler, and B is an inhaler with a spacer attached. Corticosteroids act as an inflammatory medications and lessen bronchial tube swelling. Many inhalers were given twice daily, but newer ones like Briolipta require only once daily dosing. Inhaled corticosteroids in combination with long-acting beta agonists, which we sometimes call LABAs, are the most effective treatment to prevent severe asthma exacerbation in patients with chronic asthma, as shown in the Salmeterol multi-center asthma research trial, which we call SMART. So here's just kind of listing some asthma prophylaxis treatments. Again, talking about the ones they take every day to prevent triggers of asthma. We already kind of talked about LABAs, long-acting beta agonists. And we have Servant Discus, indicated for asthma maintenance, which we already kind of talked about. And for leukotriene receptor antagonists, which we talked about when I was going through that chart. These reduce inflammatory actions, and they induce bronchial smooth muscle contraction and airway edema and mucus formation. So Singulair is a pretty popular medication. It is indicated for asthma, allergies, and bronchospasm prophylaxis. We talked about Daliresp in the previous chart. We also talked about short-acting beta agonists in that chart and anticholinergics. COPD comprises a group of chronic pulmonary diseases that restrict airflow. And 21.1 is just a figure of airway obstruction. A is the normal lung, B is with emphysema, C is with chronic bronchitis, and D is bronchial asthma. So you can see all the differences. I'm just listing more of the medications we talked about previously. Pneumonia is an infection that causes acute lung airway inflammation. This infection can affect one or both lungs and individual lung lobes. Bacteria, viruses, fungi, protozoa, or parasites can cause pneumonia. Aspirating food, fluids, or other foreign substances into the lung can cause aspiration pneumonia. Most people recover from pneumonia with rest, hydration, and appropriate medication. Of those admitted to a hospital, only a fraction die of pneumonia. So we have drug treatment like Zithromax or Z-Pak, which I'm sure many of you have already had in your life or seen. It can be given oral or intravenous, so it can be given as a discharge medication or a medication in the hospital. We have Levaquin, which treats pneumonia and community-acquired pneumonia, like from being in the hospital or from being like in a nursing home. Tuberculosis is a leading cause of morbidity and mortality worldwide. At one time, TB led as the cause of death in the United States. TB management can be difficult because the causative organism, Mycobacterium tuberculosis, is often drug resistant. Although the bacterium typically infects the lungs to cause TB, it can affect other organs such as the kidneys, brain, and spine. The primary treatment goal is to eradicate the bacteria with antibiotics and prevent drug resistance and disease relapse. It's highly contagious, so healthcare workers and other at-risk individuals in health centers often test positive for illness with the tuberculin skin test. A skin test shows whether a person has developed a tuberculosis immune response. People test positive if they have an active TB infection, if they're exposed to TB in the past, or if they receive the Bacillus calamite guerin BCG against TB, which is not given in the United States. So here's positive results on a TB test. So if you ever work in a hospital or a healthcare center, you are definitely going to have to get a TB test before going, before like during your interview process or your onboarding process. And if you work in the hospital, like doing delivering meds or whatever, you will see the rooms that are possibly tuberculosis positive, because all the nurses will be wearing like helmets in there, and they'll have like PPE on the door and stuff like that. And here's select medications used in the treatment of tuberculosis. We have Myambutol, Trocator. There is PZA, Prifton, Mycobutin. isoniazid, which you might see, it's oral, so you might see that in the retail world. Rifampin, which is also available oral, so you'll see it in the retail world. It's also for a meningitis infection prophylaxis. Lung cancer is the most common cancer worldwide. It became the most common cause of cancer deaths in men in the 1950s. It became the leading cause of cancer death in women in the mid-80s. With reduced smoking rates, death rates from lung cancer have decreased in recent years. Lung cancer refers to malignancies of the airways. Approximately 95% of all lung cancers are classified as small cell lung cancer or non-small cell lung cancer. This classification fits closely with treatment and prognosis. So for the treatment, we have the medication platinol. We have navalbine. And then we have, remember the following sound alike, look alike drugs. So diphenhydramine versus dicyclamine or dimenhydrinate, epinephrine versus ephedrine, Alupent versus Atrovent, and albuterol versus atenolol.